I have thyroid. Don't too much rely upon the laboratory investigations. Rather, try to focus on the subjective as well as the subjective feeling of the patient, and also your assessment based on the dosha. For example, you are treating a thyroid patient. Patient is having many symptoms, maybe constipation, maybe joint pain. There are many exercise symptoms. You have got set of medicine. Don't look at don't expect that TSH is 100 or 50. It comes down to 7 normal. No, it will not happen. Sometimes it will stay there. The moment a person feels subjectively better, that is enough in the initial stage, because our therapy is not sorry, our therapy is not based on correcting or biochemical balance. The modern experimentation by and large, or the modern prescription by and large, invented, described, and made for balancing that. Because, for example, you are giving a metformin to a patient. It is definitely because the very study of metformin itself, during the invention of the metformin itself, basically it is the purpose is made to have hypoglycemic and anti-hyperglycemic effect. So it will come that point. But when we prescribe nishamalagi churnam or nishagadagadi kashayam, it will not work like that. It may bring some time, it may not. We have to have our own tools, our own way of assessing the patient, not only because of the biochemical or laboratory investigations. Rather, we have to have our own subjective and objective criteria and meeting to that.
Okay, sir. Sir, also when we talk about the Toya preparations, you have already described about the Toya preparation prameha. So, how important is Toya preparation in thyroid as well as in obesity conditions? Sir?
Very, very important. Basically, in prameha and thyroid, both it's a Kleda Vyathi. So water consumption has to be under control. At the same time, when we have a toya preparations, which have a sustainable dhatu agni level. You see, while explaining Jwara, Krishna Kalpalpamushnamu Pibed Vadakapanchare, Tatkapam Milen Nitwa, Krishna Mashik Pravarti, simple Shadangam, Kanajandana Chumbia, Varpado Shita Sadita. Even in the Jwara context. Whenever whenever you want to work something from the Koshta to Dhatu level, multiple dosage, small amount. Toya is the excellent thing that can work through Ahara Rasa to Rasa Dhatu entry. Toya Paka, Toyas are the entry pharmaceutical forms from Ahara Rasa to Rasa Dhatu. That is why in Ayurveda a lot of Toya Pakas are prescribed. And it is very, very effective too.
Okay, sir. Sir, we have a question from Dr. Jyoti. During giving sesame oil, should we give aushadis like Varanadi or after giving Virechana? Sir, after Virechana, Agni will be low. After how many days of Virechana, we should start giving the aushadis?
Okay, now after Virejana, third day onwards, you can start Kashayas, no problem. Because Kashayam basically, Varanadi Kashayam and all basically, even Agni is little low, it's fine. But if you are using medicines like Thaila, I mean medicines like a tablet or a thing, that's the issue. But you can start Varanadi Kashaya even the third day itself. No problem with that.
Okay, sir. Sir, you had mentioned about giving ISKRT to diabetic patients. So, is it fine because it is a Arishta Kalpana?
Fine, fine. Many aristas, even the Nishamragi Churnam, we in SNA in company, we made arista form called Amalagasavam. No problem. No problem. Basically, you see, this is the problem. We think that the sugar is the major victim behind it. Actually, sugar has nothing to do with diabetes. If I drink 2 glasses of payasam, do I have a diabetic? Do I have a hyperglycemia in my blood? No. Because when I drink 2 glasses of glucose, if I drink a Sprite, it may be having so much of glucose. The moment if it goes to my mouth, the gastric secretions, there will be a message goes to the pancreas, the beta cells, silencer glands. It body will have an inherent capacity to judge the amount of glucose level that can be reached in the bloodstream after the metabolism. So according to that, there will be a slow releasing of insulin happens from the beta cells. Otherwise, sorry, but has nothing to do with it has nothing to do with the sugar consumption. But once the disease manifests, sugar become a challenge. Otherwise, whether it is an arista, that's not a problem. Ice can be given.
Okay, sir. Sir, along with that, can I ask you whether we should give ISKRT in obese patients just before food? Is it
Yes,
advised?
yes, yes. Ice is a very good concept, a very good medicine to bring both diabetes and obesity.
Okay. Sir, next question. How to understand and treat as per Ayurveda if only fasting blood sugar is high or only after food PPBS is high?
You see, PPBS is high, suggestive that there is a delay in recognition of uh, blood glucose. That means when a person consume a food, body have an inherent capacity to identify how much glucose is there after metabolism, which comes to the mainstream of the blood. There will be a perception from for the pancreas, the beta cells, and beta cells will slowly start producing. If there is some problem happens in the beta cells, maybe an autoimmune manifestation, or it may be some other disease, or an inherent problem, that makes PPS challenging. If the fasting blood sugar is high, this means that it takes a short, long-acting nature of the insulin in the body. That is, it takes long. The sustainable demand of the things is not able to think. That is why short-acting and long-acting insulins are available in the market. But in reality, in body, there is nothing called short-acting, long-acting. It is a short-acting decision and long-acting working. That's the thing. So in such cases, what we have to do is that whenever there is a fasting blood sugar things are high, this means that it is the problem of the Agni. You have to work more on the Dhatu. Whereas if it is a PPBS, then it is related with Koshta. So you have to give some medicine for the Koshta Agni. That's a clue we can take it out of that message.
Okay. Sir, most often when a patient comes to us with a high sugar level, we obviously start giving Nisha Katagadi Kashaya, etc. So for how long should we continue this Nisha Katagadi Kashaya, and when to switch from this Nisha Katagadi to Shilajit Rasayana?
Very good question. This is the big problem very often practitioners comes across. People will be prescribed Nishagatagadi Kashayam or Katakagadadi Kashayam. They'll be drinking for years together. It's not correct way. Very oftenly, it is just they think that it is a co-prescription with metformin. They will take metformin or a glimepiride plus Nishagatagadi Kashayam. That's not the correct way. And after the purpose of Nishagatagadi, this will also increase a lot of Vata Prakopa. Increases Vata if you give too much of Nishagatagadi because Nishagatagadi, Techipa, Choti Badriga, all these medicines long run will have Vata Prakopa. Okay, so you start with the Kashaya, and when you find the person is moving from Kapha state to a Pitta state, or Kapha state to a Vata state, then definitely you have to withdraw or stop Nishagatagadi Kashaya, move on to some ghee preparations. We have ghee preparations like Dhanandra Khadam, which is available in the market for Prameha. We have many other medicines like Shilajit is there. There are many other medicines. Even Chandraprabha will be a very good choice. Stopping Nishagadika Swayam, sticking on to turning toward from Nishagadagadi to Dhanvi. It's not a number of days. It depends upon the patient's phase from Kapha state to Pitta state to Vata phase. That's a crucial thing. Initially, few months Nishagadagadi is fine. But I don't prescribe the people to take Nishagadagadi for months together. It's not fair.
Okay, sir. Sir, which kalpa can be used in lean diabetic patients?
Actually, whether it is an obese or a lean, the purpose here is to that if it is a lean, we have to have a responsibility to increase Dhatu Agni and to have bring some Dhatu portion of. So start with such patient, you will have a probability that their Dhatu Agni is low. So you start with some Dhatu Agni improving medicines, that which is containing Pippali, like that's those having Agni. Even a good example is you start with an Ashtavargam Kashayam, or you start with a Nayopayam Kashayam, Balajiragam Nagari. This type of Agni Deepana medicine you give few weeks, then switch on to some Brahmana medicines like Dhanandra Krita. Even there are even the products like Dhanandram Avartanam, 3 times, 7 times. These type of medicines you can give for the lean diabetes patient. Choose medicines which is Brahmana, like Krida. Choose medicines with Rasayana nature is the best choice for diabetes patient.
Okay, sir. Sir, nowadays, due to this improper lifestyle, we get a lot of kids coming to us with in a pre-diabetic stage. So, what all kalpanas, or is there any pathyas or any treatment that we can give so that they won't go into the diabetic stage?
You mean the pre-diabetic?
Yes, pre-diabetic conditions.
Okay. If there comes with the lifestyle issues, first we have to correct them. It is a very, very big challenge, especially in this COVID period. A lot of children are tendency to become pre-diabetic. They put on weight because they haven't have opportunity to have a physical activity. They were not able to go for a swim. They were not able to cycle. They have restricted themselves. So meantime, they have to have a caloric balance. So they have to have a good protein. Yes, fundamentally from Ayurveda is that carbohydrates is the Lahu medicine. Then we have protein, slightly guru. Then we have fat, that is more guru, like ghee, etc. Then we have other higher materials, minerals, metals, and all. Also, guru, they are needed in small quantity. So, carbohydrates, proteins, fat are the trilogies. Taking from guru to laku to guru. So, we have to try to understand based on the Agni. The person is having poor Agni, carbohydrates have major role to play. The person is having slightly better Agni, you contribute more protein. Then if person is having more, very strong Agni is there, then definitely lipids are having a bigger role to play. In that way, we have to plan. And in children, it is very, very important to reduce their sedentary life. We have to give some medicines. But I prefer let them give some Nishamlaki Churnam as a beginning is a good choice of initial area for the children.
Sir, next question from Dr. Anuja. It's a proper doctor-patient relationship question because nowadays layman is always concerned about the sugar levels, just normalizing the sugar levels. So she is asking how we can convince the patient by telling our essence of our treatment.
Very good question, Anuja. This is a big challenge Ayurveda also facing because we have to find our own tools now to satisfy the people. Not, many of our products may be bringing some hypoglycemic effect, but as I mentioned rightly, that many our medicines may not be able to bring sugar level. For example, I'll give you a simple example. Patient comes with a back pain, and we make an MRI of the patient, and they will say there is a disc prolapse in the L4, L5, etc. Severe pain, not able to walk. So get it admitted in the hospital. We give treatment, Kadivasti, etc., LAPA, etc. Patient is absolutely fine. Then if he goes to go for an MRI and check the MRI, the problem still there. So patient will again ask, doctor, I have this still disc prolapse. I'm still able to work. I'm still able to do everything. So the same problem happens here also, because biochemical balancing is not our work. Biochemical balancing is okay. We are able to do fine, but it not always happens. So we have to explain the patient that okay, we are not working on objective, observable, detectable data. Okay. Rather, we are working on the whole system medicine. Ayurveda is a whole system functional medicine. So we are looking for the pathological thing, invisible, which may not be able to measure in the sugar level. By a long run, we may able to demonstrate you, okay, your sugar level is normal now. But we can assure you after a year, your HbA1c may be better, may be better. That's the only way we could able to do, because will be very foolish if we start correcting this biochemical balance, even in the thyroid, even in the obesity, as I rightly mentioned, the BMI. You see, the BMI method is the biggest foolish thing people does. Even in the diabetes also, we have a lot of people, maybe fasting blood sugar maybe 200, fine. If they are subjectively functioning, it is fine. Don't be obsessed with these laboratory investigations. It is an indicator, not a confirmatory. Laboratory investigation is an indicator. It is pointing out you that it may. That's all. It's not a confirmatory. This point they have to highlight. Good question.
Okay, sir. Thank you. Sir, next question. Sir, a patient, an asymptomatic patient, just went for a routine lab test and found that he is having TSH 100. So, whether to, it's a dilemma whether to treat it or just leave it.
As I told you, that TSH can go high at any time. There are many situations it can go high, but a symptom not necessary also to come. It may be a non-thyroid illness. Hmm? For example, if I go for a trekking, if I'm going for a Himalayas, I have to walk 15 or 20 kilometers a day. Hmm? Base camp of the Himalayas. My TSH level will go high. Why? Because body has enormous need of an energy, which TSH has to push. T3, T4 has to increase. That's the thing. So we have to exclude all physiological possibilities first. Second thing, we have to exclude all other possibilities related with extra thyroidal problem, extra thyroidal issues like chemotherapies. There are so many other things. And even at that situation, then repeat the test because it may be of lab mistake. That's also possible. Because the sample may be wrong. So better you check it again. That's the best thing before you start treating. Maybe there is nothing wrong if TSH is hundreds, no symptoms, no need to be hurried. Wait for 4 or 5 days, let him have a proper sleep. It may be a severe stress. Improper sleep, TSH will alter. A family member died in the house, last 2 3 days, the person doesn't slept well, TSH will shoot up. It may be not 100, 30, 40, but still. So all these possibilities exclude. Wait for a week, because there is no emergencies that TSH goes high. It can, a patient may go to hypothyroidism, coma. No, there is no problem. Something like that in the life. Do it like that. Be very practical.
Okay, sir. Sir, nowadays we get a lot of juvenile diabetic cases. So, when we are administering medicines to the children, is it like the same medicines, or is there any difference that we have to?
We can use similar medicines, but remember that they are having Thadwagni problem. They have a OJS problem. they are pitta, amla avastha, they may have an amla taste because they are in the growing age. So amla vidagdha avastha will be very, very high. So you have to be very careful in giving medicines. The medicine that will not be increasing the pitta, too much of amlatva should not be there. Basically, it should be supporting the dhatu agni is the major thing. But it'll bring some good result also, but not as good like the diabetic type 2.
Okay, sir. Sir, as you told when you were presenting that T3, T4 levels and TSH levels, when they are high, in hypothyroidism conditions, when TSH is high, we give medicine for a certain period, and we see that the TSH has little bit reduced. So, for how long should we continue the medicines?
You mean the Ayurveda medicine, right?
Yes, sir. You're right.
Normally, once we are able to stop the whole modern medicines, it may be needed for another 5 to 6 months. Then we may able to completely withdraw and stop. Provided there are few categories of people who don't take this. Is it a woman of reproductive phase expecting a child? Don't do that, because thyroid may get short-term stimulations. It will stimulate when there's a pregnancy. So there may be a strong demand from the thyroid to increase secretion fastly when the pregnancy is there. So maybe your treatment may not be enough. So that may end up with some risky factors like cretinism and all. Don't take that type of risk. That's the only thing you should remember. Otherwise, it's fine. Also, check there is no growth. Goiter is not manifesting. Ask the patient to come after 6 months, check the nodule, neck status, and all, because if there is any producing nodules and other things for the safety, not for medication.
Sir, if in case we see a nodule, is there any LAPAs that we should prescribe?
No, if it is a simple nodular goiter, we can use Grahadumadi, Dhanyamlam, this type of lepas will be fine. It can bring some changes. But if it is when you examine, if it is, you found some nodules are a little hard and all, better go for a neck USG to know the texture of the nodule, so that you may able to exclude them, including excluding the malignancy.
Okay. Sir, another question from Dr. Jyoti. Sir, Shundi, Vidanga, Jeera, and coriander seeds used as Toya Kalpana in diabetic patients. Will it be useful or not?
That's a very good. Shundi, Vidanga, Jeera, coriander is a very good choice. It's fine. Good Toya Kalpana.
Sir, any other Toya Kalpanas that you would like to say in this time?
It depends. It depends upon the whole thing, like Kavaja Prameha, Pitja Prameha, and all what the Kashaya described in the Prameha, as I mentioned, Gayatri Adhika Kashaya and all. You can make those Toya Kalpanas easily, and you can use it. That's also possible.
Sir, due to this COVID conditions, we have been hearing a lot of diabetes post-COVID as a complication. So, how to understand that and how to manage this? Is it the same way we see a normal diabetic patient, or?
Mostly, maybe after COVID, since this virus is affecting our immune system and challenged our immune system, still it is under observation. But I would like to say that a lot of autoimmune manifestation will be alarmingly increasing. So autoimmune atrophy of the pancreas producing type 1 diabetes in the children, autoimmune thyroiditis, Hashimoto thyroiditis, autoimmune induced type 2 diabetes, and complication may be there. So what we may be able to focus on is the autoimmune nature of the body is alarmingly increased after COVID. It may, nowadays, maybe we have to speak with the dermatologist whether this number of cases of psoriasis are increased, whether number of bronchial asthma increased. Because there are so many autoimmune other diseases also there, like psoriasis, asthma, and all. Maybe that also will come to the scene. But currently, endocrinological perspective, these diseases are alarmingly high, mostly due to autoimmune problem, and we have to focus on this.
Okay, sir. Sir, next question from Dr. Ujjala. Sir, when patients come on, means when patients come to our clinic who are on regular hypothyroidism, hypothyroid treatment, and now their blood reports are normal and they don't have any other symptoms or lakshanas, so but they want to stop the allopathic treatment and come for ayurvedic treatment, so in that case, how to see the case?
You start with Kanjanara Gugulu, Hamsavatyadi Kashayam, or Dadimadikardam, these type of products for a month. Then ask the patient to withdraw that medicine, whether it's a 50 mcg. First 3 months, you reduce that 15 to 25. Then next 3 months, you 25 to 12.5. Then you stop it. That's a protocol easily be followed. Some people I used also to give Saturday, Sunday higher doses, especially in the woman, because Monday to Friday they will be working. Monday to Saturday, Friday they will be working more, and Saturday, Sunday they will be doing a lot of work in the house, kitchens, and all. Maybe there are that method also be used.
Okay, sir, another question from Dr. Ujjula. Sir, FBS is showing pre-diabetic stage, but at the same time HbA1c is normal. So how to understand this?
HbA1c shows the hemoglobin binding nature over 3 months. This is the overall perception of the diabetes. Fasting blood sugar is a short-term, immediate effect. Fasting vegetable is not a confirmatory to any diabetic thing. It can vary at any time. So don't take fasting blood sugar as a very important thing to be done. It varies.
Sir, when in a hypothyroidism patient, when we see swelling in the feet, is there any medicine that we can give?
If it is a swelling in the hypothyroidism, mostly may not be due to thyroid dysfunction. Maybe other possibility may be there. Whether maybe it is a drug induced, whether the person is taking any statin like thing. Thyroid dysfunction as such doesn't have that much. It can bring edema, but leg edema is not very common. Okay, we can use medicines like Grahadumadi, Dhanyamlam applications. It can bring down.
Okay, sir. Sir, just one or two questions last. Sir, in thyroid goiter case, for doing Jaluka for Rakta Mokshana, should we apply specifically any Jaluka on goiter area or on hand or any other part of the body? Is
No,
it
in the
necessary?
neck itself. In the neck itself. It is in the neck itself. We can apply Jaloga. There is no problem. Be very careful that you are not attaching to the carotid artery. That's the only thing. Because there are near side there are a lot of major vessels is passing. If it is a fat person, it's fine. But it's a very thin person, you are attaching a Jaloga, and if it attaches to a carotid artery, the whole story will be changed.
Right, sir.
Okay.
Sir, just one last question. Sir, in diabetes means when diabetes comes, like arrives in a body, it usually creates a decrease in the weight. So most of the people are concerned about increasing the weight. So once the diabetes has been controlled, so what all gritapanas or any other rasayanas that we give for weight gaining alone?
That's what I told. Carbohydrates, fat, and lipids. These are guru to lepu. So oftenly people what they do is that they reduce taking carbohydrates. They will switch on to more proteins. But protein is guru than carbohydrate. So they have to make sure that Agni should be very good. If you add them into more protein and more fat, it is fine, they will gain weight. But both are guru, snigdha, pichila is more. So make sure that whereas carbohydrate doesn't starch doesn't have that problem. They are lattu. They are maybe snigdha, maybe asnigdha also. So add a little carbohydrate slowly, then turn slowly into protein and fat. is more better choice. We have many kridas in Ayurveda, many kridas like Dandapura Kritam is also there. Dadimati Kritam is also there. Indugandham Kritam is excellent Kritam. You can recommend the people to take. No changes in the glycemic index also. It will not produce much problem.
Sir, what about Vidaryadi Gradam?
Of course, with Aryadi, definitely.
Okay. Sir, one of our participants would like to talk to you.
Okay.
Hello. Hello, good evening, sir.
Good evening. Good evening.
Uh,
Namaste.
Very nice session, sir. Sir, I have a question. Means in Stolya or any other Prameha case, first we go for Pachana, then Deepana, and you told in Stolya we should go for Anulomana also to balance the Vata. So, if whether we should give for Anulomana always or like Arogyavardhini Kalpa, it always means it contains Kuttiki. So, along with that, we should give separate Anulomana, or if Arogyavardhini we give, na, so that Avrod will go off. So, automatically that uh, Avrod will go off and Vata will be in their sthana. So whether it is compulsory to give along with any Anulomana like Gandharva Haritaki or Gomutra Haritaki like Kalpa, is it
Not
necessary?
necessary. Not necessary. If you're already given Arogyavardhini, Triphala Gukulu, this type of medicine you're already given, that is enough. Then you can directly switch into the treatment.
Okay, sir. Thank you, sir. And one more, you have shown in the slide, starting in Sthola, starting stage Kapha is more, and latter stage Vata is more. That I didn't understand, sir, because this Sthola will be uh, always with Kapha, Meda, Rasa, means
No,
that
doctor.
I didn't understand.
Yeah,
Yes,
no, doctor. The initial phase or only initial phases of obesity is only the kapha dominant phase, kapha meda dominant stage. Later stage, vata is making all this problem. If it is a kapha problem, we could have deal it very easily. Why we are not getting good result? If the person does fasting, when person do lot of exercise, are you getting very good result with
no,
when
sir. That's
person?
why
You know, even
I
you are.
asking.
Yeah. Even you see, ask the obese person how much he eats, or he or she eats. They will say that, doctor, I am eating very little, doctor. I take in the night only one chapati. Still, I am not losing weight. Doctor, I am not eating rice at all. I am taking only 1 cup of rice in the lunch time. I take only 2 dosa in the morning. Still, I am putting on weight. They will say almost 1 year like that in that diet. Still, they are not losing weight. What does it shows? This shows that this is the whole story. We are misunderstood that the obesity is a kapha problem. It is not a kapha vyadhi, it is a vada vyadhi. I should say in other way, obesity is a vada vyadhi. Vada vyadhi, don't think that vada vyadhi chapter, but it is a vada problem. I should say vata problem. But in a degree of vata problem may varies from person to person, but it has a significant role to play in vata. If we are not able to handle that vata, we are not able to be at all successful in the management. That is why most of the time medical science fails in obesity management. This is not only for the